Today I am here with my psychiatrist, Dr. Gokhale, and he's been generous enough to take time out of his busy schedule to answer a few questions about his profession. So, Dr. Gokhale, tell me about your job. Is what you do different in any way from the others in your occupation?
Okay, so in psychiatry, people can do inpatient work, outpatient work, or combine the two. So I see patients in the office, and those patients who are very sick, who needs to be in a controlled, safe environment. I see them in the inpatient program. To add a wrinkle to the whole deal, I work at a hospital or go to a hospital, which is a general medical hospital. So I do consultations on different floors for medical patients who may have psychiatric comorbidities.
Okay. Can you tell me about your background and why you decided to go into this field?
Very interesting question. I wanted to be a surgeon, and during my training I seemed to feel pretty good with my hand skills. But the thing that I was very intrigued by, when I did cover for my colleague in his general medical practice for 1 month when he got married and took time off, I found large chunk of patients who came to his office for various medical ailments. About 30 to 50% of them had some challenges with their emotional state, which was causing the symptoms or aggravating what they were going through. So that always kept me intrigued about what does this mind-body connection is all about, and that got me gravitated towards psychiatry.
Okay. What personal characteristics would you say are required for someone to be successful in your job?
I think every doctor who gets trained has adequate knowledge, so I feel that you need to have. Having said that, it's truly more of a people profession where you really need to like dealing with human beings of all kinds. Some are easy to deal with, some are tough to deal with, but you need to understand that your job is to connect with them well enough that you can work with them and help them with their challenges.
What types of patients do you see?
That's a very interesting point. I see patients of all kinds. So I see kids, I see adolescents, I see young adults, and I see old patients. Technically, I'm trained to be a general psychiatrist, so I see people with all psychiatric maladies, from anxiety to depression to schizophrenia to bipolarity to dementia to addiction to eating disorder, and each one presents its own challenge. So it never gets you bored dealing with just one kind of patient population.
Can you describe a day or a week in the life of your profession?
So different folks in my profession would do different things. There are those who have fixed, defined hours, which is great for them. There are those who work only for the hospital, and so they only do inpatient work. So they go for 8 hours and they go home. General practitioner like me, who is on his own, he is basically on call 7 days a week. And so you work technically all the hours you're needed. So in my office, usually I start work first in the hospital. So I get to the hospital between 7 and 8, see my inpatients, and then come to the office. And depending on how long I choose to work, I work from mid-afternoon to late evenings.
How much job security is there for people in your career?
I think, just as we say, the babies will continue to be born, the human beings will continue to struggle with their emotions. So I think one way or the other, one would be always needed.
What other jobs could you do with the skills you have gained in this field?
One thing I do is I teach medical residents. So one day when I retire, I would love to be a teacher, a professor somewhere in teaching psychiatry. That would be fun. So that would be something which is totally different than what I do now. I could retire and choose to see only 6 patients a day and get back to doing psychotherapy again, which I used to do way back when. So those would be the 2 possible options. Or I could become a starter on a golf course.
What what do you think the future holds for people in your profession?
Difficult question to answer. It's truly intriguing because psychiatry has become a lot more biological. But I think we should not still lose the fact that connecting with a patient and working in some form of therapy is equally crucial. It may be that neurology and psychiatry may get closer to each other, and so the biology and the psychology of the brain may be tackled more effectively by someone who is kind of trained in both fields. But that's just a thought, I'm not sure.
What are the challenges in your job?
The challenges would be the changing field of psychiatry. By that I mean, in the olden days, a patient who would be depressed and suicidal and who would be in the hospital, we had time enough to work with them. Now, because of the demands from the insurance companies, a patient who may have tried something very serious, you are constantly pushed to justify a patient needing to be treated as an inpatient. So when you discharge someone who has been acutely suicidal just week, 2 weeks or few days ago, that's a stress you carry with you.
Right.
Right. That's uncertainty because we have no crystal ball to kind of predict who may be dangerous or not.
Okay.
So you just work the best you can with all the resources you have.
Okay. And are there many opportunities in your field? And what advice would you give to people who want to get started?
I think the field of psychology is continuing to be a wonderful field to work in. So no matter which particular facet you get in, as a licensed clinical social worker, licensed clinical counselor, a psychologist or a psychiatrist, if you keep the enthusiasm about working with the human mind, then any of those titles would allow you to work in different shape and form with different patients that you treat.
Okay. All right, well, thank you very much for
My
taking the
pleasure,
time out.
always.
All right, thank you.
Take care. Thanks.